Good afternoon, everyone, and many thanks for accepting our invitation. My name is Ettore Greco. I am the Vice President of the Istituto Affari Internazionali, Istituto International Affairs, and the Director of its program on multilateralism and global governance. I'm very glad to open this webinar on global health cooperation in a time of Polycrisis. This meeting takes place within the framework of our partnership with Friends of the Global Fund, with which we are conducting several activities this year to promote debate and dialogue about global health and development cooperation. Last week, I'd like to underline with Friends of the Global Fund, we launched the first meeting of a private sector lab, that's the name we have chosen, with the aim to enhance the dialogue between the private sector, Italian institutions, and international organizations such as the Global Fund to fight AIDS, tuberculosis, and malaria. But let me also stress that for the organization of this meeting, we have also cooperated with the Foundation Focus 2030, another of our partners. Focus 2030 is a leading institution on development policies which promote a large network of study center working on that issue. I think we are all well aware that, especially in a time of polycrisis, the fight against diseases such as tuberculosis is not only a medical challenge, but also a matter of global security. Geopolitical instability and conflicts compromise diagnostic and treatment system, very often causing health crises and health emergencies that undermine international security. So we have to look deeply into the nexus which may shape profoundly the international environment. Today is the World Tuberculosis Day, and we want to discuss global health and the challenges posed by tragic diseases such as tuberculosis. The data are very concerning, over 10 million new cases and 1.23 million deaths globally in 2024. In this scenario, the impact of new technologies such as artificial intelligence for screening, new medical innovations such as new vaccines, and more other instruments they are being established, introduced, including more affordable diagnostic tests, could make the difference if coupled with strengthening our local health system, especially in a country seriously hit like Africa. And this is especially true in low and middle income countries where significant governance deficiencies and social hurdles and impediments persist. In such difficult time for international cooperation, it's important to stress that multilateral cooperation to fight preventable diseases such as tuberculosis is crucial, and it's urgent. It's a crucial task to foster international partnerships around shared values and goals such as health. Today's meetings aims essentially to promote an exchange of views on those issues from different perspectives and based also on various expertise of the participants. We have representatives from national institutions such as the Ministry of Foreign Affairs with Susanna Schlein, the Defense Institute for Biomedical Sciences, Italian Ministry of Defense, with Filippo Molinari, international organizations, UN agencies such as the World Health Organization and the Global Fund that you already mentioned, academic experts from the Geneva Graduate Institute to discuss how to enhance common strategies and multi-stakeholder partnership, and more broadly advance the global health agenda in light of the emerging challenges. I'm sure the debate will be enlightening and thought-provoking, providing many inputs and suggestions. So many thanks again for being with us today. And without further ado, I'm now the great pleasure to give the floor to Mikhail Kazaskin, from Professor of the Geneva Graduate Institute, for the kickoff intervention. So please, Professor Kazaskin, the floor is yours.
Thank you very much. Thank you, Dr. Greco. Thank you for the invitation to address this webinar today, and also to the IAI for convening it on the World TB Day. So let me make a few points on TB and on polycrisis. First on TB, as you said, Dr. Greco, the global TB response is currently shockingly off track. In the last 10 years, the global incidence of tuberculosis has decreased by 12%. Mortality has decreased by 30%. That is far below the internationally agreed 2020 targets of 50% and 75%. The problem is not so much about better tools. We actually now have new bedside diagnostics, novel therapeutic regimens, novel drugs, but rather, as Director Greco pointed out in his introduction, in persisting systemic issues, equitable access to innovative tools, overstretched health systems, sustainable financing, and stronger global strategic approach, cooperation, and governance. These systemic issues need to be addressed at both domestic and global health levels. And I see tuberculosis as both a domestic issue and a global health issue. Domestic, since health systems and TB programs are run by national governments, and since domestic fundings makes up to 80% of TB financing globally, and even in greater proportions in the BRICS countries. But global, because TB is a global health issue that is a transnational health risk, that requires a collective response of the international community. A health issue that is subject to global goals and international agreements, specifically SDG 3.3. And this is where the polycrisis comes to play. We are in times of crisis for global health, and we are in times of polycrisis. On global health, progress is lagging behind. Domestic funding of health in low and middle income countries is not increasing as it would need. And official development assistance in health from wealthier countries to LMICs has been steadily decreasing globally in the last 5 years, and expected to be 30 to 40% lower this year than in pre-COVID times. As everyone would know, in the beginning of last year, several executive orders were issued by the new US administration that radically changed US foreign assistance. The dissolution of USAID, the cancellation of most foreign assistance grants, and stop work orders for programs underway. And this year, saw US health funding shifting from a multilateral approach to bilateral deals. This year also saw major, I would say unprecedented reductions in ODA in health from European donors, including in funding their commitments to the Global Fund that provides most of the international resources for tuberculosis. These reductions are expected to result in millions of avoidable deaths and severely weakening surveillance and preparedness capacities. Modeling studies have estimated up to 2 million additional deaths from TB and 5 million more cases between 2025 and 2035 linked to a diagnostic and treatment interruptions, reduced case detection, increased incidence of drug-resistant TB, catastrophic household costs, and the ending of key research programs, including on new TB vaccines. At the same time, we're living in times of increasing polycrisis, and if I may say so, of poly-uncertainty. Huge technological transition, mass migration movements, climate change spiraling out of control, wars, and struggles for a new geostrategic architecture fueled by power players fighting for a place in a new distribution of forces and alliances. Autocracy has increased, authoritarian and populist movements have grown, and polarization, disinformation, and distrust have proliferated. Power asymmetries, deepening social inequities, and forces external to the health sector, especially geopolitical rivalries, national security agendas, and economic interests, increasingly shape the global health landscape and preclude effective governance for health. If I can sum up, I would say the world is not safer than it was 3 years ago. We may ask whether these changes are the symptoms of a transitory storm in American history, or part of a broader groundswell that will durably affect liberal democracies globally. But in any way, we should not pretend that we can go back where we have been for the last 20 years. We need to acknowledge that the comfort provided by US hegemony over decades has prevented the implementation of many necessary structural and governance reforms in global health and development. The global health architecture that has evolved over the past 2 decades is clearly unsustainable in a world where the ODA that funded hundreds of initiatives and organizations is now cut by half. Significant changes will be needed, both to seek efficiencies and to focus on the most important long-term priorities, of which, of course, TB is part. I believe that the current crisis is a tipping point towards a world order where low and middle income countries will have to take on a larger burden of health spending and must therefore assume also a greater role in driving global health decision-making and controlling the use of international funding. The future is one in which ODA will complement rather than dominate many national efforts. Advancing towards sustainability at country level will not be easy. Those countries that were seeking to transition gradually from international financing for health now face a sudden and brutal shock. A transition is not a shock from one day to another. And highest burden countries with escalating debt will critically face crucial challenges. So although we may not understand the full scope of the shifts now underway, we know that countries must start the work now of preparing for different scenarios. At global level, we need to re-articulate the concept of global solidarity and interdependency, and probably to frame it better under a global health security headline. We need to recognize the weaknesses in the international system. Here I may cite the 5 core global governance dysfunctions that the Oslo Lancet Commission had identified about 10 years ago as impeding health equity: democratic deficit, institutional stickiness, inadequate policy space, weak institutions, and weak accountability. So, dear colleagues, our shared goal should remain to end TB. And our shared view, I strongly feel, should remain that ending TB requires a common effort of countries and the international community, and a joint effort of governments, international organizations, civil society, and the private sector coming together in a common fight. We cannot abandon these core values, and we should not abandon goals that the world has agreed to and we all have worked so hard to attain. More than ever before, health will be a political choice, the choice of prioritizing health against other priorities. In this regard, connecting the diplomatic, security, medical, and scientific communities, as it is done by the Istituto Affari Internazionali today, is an advance towards re-establishing TB and global health as global political priorities. Thank you, and over to you, moderator.
Thank you very much, Professor Kazaskin, for your words. And it's very interesting to understand the link between the international dimension and the domestic one. As you said, it's probably tuberculosis. It's not now a problem of better tools, but rather on persisting systemic issues that you have so well highlighted. And it is, in this sense, I would like to recall that tuberculosis is one of the world's leading infectious killers, hitting 1.2 million cases per year. And it's often called the disease of poverty because it is really very much related to a social issue of inequity. And we will maybe have the time to delve a little more on these struggles, on these socioeconomic struggles related to tuberculosis. In this sense, I would like to understand with our panelists, which I also thank for being here and discussing with us global health and tuberculosis on the World Tuberculosis Day. I would like to understand with them what are the challenges on global health that we are seeing. Professor Kazaskin said very well, it's not maybe an issue of technologies and innovation, but now it's more about the difficulties of the international scenario and the crisis, perhaps, of international cooperation related to development. But let's talk about that with our panelists. And I would like to introduce the first one, and it's Susanna Schlein from the Italian Ministry of Foreign Affairs. And I would like to understand better the point of view of a diplomat working day by day on global health and international cooperation. We know very well that Italy now is promoting a very important initiative towards Africa called the Mattei Plan, and within the Mattei Plan, the health pillar is one of the main goals that Italy wants to promote with African partners. So let's understand, what do you think are the challenges now, and what can you do to tackle them? Please, Dr. Schlein.
Thank you, Mrs. Nuradini, and thank you to Professor Kazakchin for the introduction. Very, very interesting. Good afternoon, everybody. Thank you for having me here to the Istituto Affari Internazionali. What are the challenges? The challenges were already very well depicted, I think, by our first speaker. We all know that we are in a period of profound transformation, multiple global pressures, multilateralism is under strain. You can imagine I'm the head of a unit called Unit for Multilateral Affairs in the Development Cooperation. So we are dealing with this every day. The ODA, as we already heard, is declining. Italy still has until now resisted this tendency. Until last year, we were going up, but the trend internationally is clear. And it is a dramatic decrease in resources. So we all understand very well that all of this together, I mean, geopolitical tensions, the reduced engagement of fundamental donors, such as the US, the constrained fiscal space, the rising debt vulnerabilities are all together creating a really very challenging environment for the global health system in this moment. And this naturally has very concrete effects, unfortunately, on health systems. So it's not something abstract, you know, especially in low and middle income countries, and most notably in Africa. You know very well the high burdens of diseases, structural and social barriers that continue to limit access to care and life-saving products create a very difficult situation. We shouldn't forget, I think, that we achieved very important results in the last decades, also thanks to important initiatives as the Global Fund, as Gavi. We had an impressive reduction of mortality, fortunately, but still, as you were saying, Professor, HIV is not defeated at all. Malaria risks to have a dramatic resurgence in the next months. And tuberculosis, I mean, it's a very important day today. Tuberculosis continues to be, as we heard, the world's deadliest infectious disease. Despite being preventable and curable. So it's really a big challenge. Tuberculosis in particular is a disease which is very much concentrated geographically. We have, I think, 95% of the people affected by tuberculosis live in Asia. I think 60% in Asia and 35% in sub-Saharan Africa. So really concentrated geographically and also concentrated in vulnerable groups and fragile contexts. I remember hearing during the Global Fund board, I'm a member of the board, that in some countries, for example, people in prison have a 10 times higher likelihood of getting infected by tuberculosis. So it's really a very concentrated disease, but this doesn't make it any easier to deal with it. And the still high number of undetected cases, I think it's estimated around 2.5 million cases, increase naturally the transmission risks. As we already heard, one of the most powerful levers to end tuberculosis and in general to progress in global health can be innovation. I won't speak too much about that. We already heard it. That's for sure very important. We should all continue to invest in innovation, but we cannot count on innovation alone. We must be able to reach people most at risk now and make our interventions more and more effective. So I think in this context, our major challenge now is not so much or not simply to mobilize more resources, because that, I mean, is outside of our control in many cases. What we need, and we are discussing about that, we have been discussing for months now, is also the capacity of using the resources that we already have more strategically and more effectively, and with a sharper focus on impact. We need this so-called reform of the global health architecture. We must cancel duplication and fragmentation. You probably know that there is an ongoing debate on that. I think the role of donors is very important. Naturally, we're not the only actors in this discussion, but it's very important. It's very difficult to change and reform such a complicated system as the global health system, but we have to put it as an absolute priority for us. We have the responsibility, and we have to feel this responsibility to achieve some tangible results on that. In this moment, there are many different fora discussing this possible reform, including reflections underway under WHO coordination, naturally, within the G7. We are discussing that, the European Union, a lot of levels, also naturally as follow-up of the Lusaka agenda. And it's very important that these efforts mutually reinforce each other, and that we are not reproducing the same fragmentation that we want to overcome in the exercise of reflecting on the reform. The real challenge is, to find a right balance between setting concrete and achievable objectives also in the short term, and pursuing transformative goals over the longer run with a more strategic view, which is not easy, naturally, but it's what we are trying to do. That also means that all the global health actors must position themselves and clearly define what are the mandates and role, and what are their added value, where they can be better than others, and what they should avoid doing, because, in order not to have duplications. It's never easy for an organization to quit an activity, but it's probably necessary. We are we think that it's very important what we are seeing going on with the task force between Global Fund and Gavi. The impression is, we had some efforts of cooperation also before, and not always very successful, let's say so. But we have the impression that now there is a shared understanding of the importance of this collaboration. It's not longer seen as a possible option, but as a really a requirement of the system. We need to be more efficient. I already said, having greater impact. We have to promote innovative financing approaches, debt conversion instruments, and naturally mobilizing more domestic resources. It's easier said than done, but it's really very important. We all know that there is a very strong request from the recipient countries to increase ownership and get to this self-reliance. We need this tailor context-specific approach, let's say, and we need to carefully manage this transition, because we are all aware, and we all agree that countries themselves must be the primary anchor for the system, and this request is absolutely legitimate. But we also have to be realistic and understand that not all the countries are in the same situation, and if some may be ready to steer their systems autonomously or almost ready, this would be a huge challenge for others. And also, we have to be careful. Our system is grounded also on the importance of civil society, and rely also on a lot of work with communities. We have also always said that it's very important also for efficiency, and naturally there is an issue there. If you say that a country is free to steer its system, but at the same time we also want to ensure that civil society is engaged and involved in the management of the health sector. So that's also something that we should be careful of. What are we doing as Italy? We have naturally which we are trying to have a strategic approach. You know that we invest a lot in the big health funds, so Global Fund, Gavi, SEPI also. And at the same time, we are trying to increase, and we are also very grateful of your work, what you began last week, increase the involvement of the private sector. Italy could be particularly well positioned in this. We have global leaders in key areas, including pharmaceuticals, biomedical technologies, and diagnostics, a lot of important areas. Until now, the Italian private sector was, let's say, not as strongly involved in the work of these global health initiatives as it could have. So for us, it's a priority to strengthen this engagement of the private sector in the work of the global health institutions. We are working on the Codewave Expo, which will take place in May, and we will also we will have an event in order to try to strengthen these relationships. As you were saying, health is an important pillar of our Mattei plan. And also in that framework, we are working also a lot with our civil society. So we have multilateral funds, we have bilateral engagement, we have private sector, and we have also civil society engagement. Our civil society is a key asset, I think, of our system. We must never forget it. They have invaluable expertise in community health, in capacity building, in particular in training of healthcare personnel. And so they are really indispensable. They can play an invaluable role in countries where, in some cases, they are have been present for decades, and we need to make the most of also of their experience. So we have to be comprehensive and increase our teamwork and build on the specific strengths of each component of the Italian system in order to attain, that catalytic effect and achieve the results we need to meet the huge challenges we have in front of us. Thank you.
Thank you very much, Dr. Schlein. And it was very interesting to understand the Italian perspective in this sense. So I was thinking about when you were describing the diverse landscape of actors involved in the health cooperation. We know we have the private sector, we have civil society, Italian and international institutions, because it's a complex cooperation in a very delicate issue such health. And to understand maybe the challenge for the Italian institution would be to create a systemic way to coordinate all these different actors and these different initiatives, because we know that Italy is also supports the multilateral cooperation in the health dimension, as you were recalling. But if I'm also recalling the words of Professor Kazaskin, and you both seem to agree that the multilateral scenario is challenged in a certain way. We know that Professor Kazaskin said that the global health architecture is soon to be unsustainable, so it needs to be somehow reformed. And if I think about that, I would like to ask the opinion of Dr. Simona Seravesi from the World Health Organization. Simona, the multilateral architecture, we know that the World Health Organization is within, of course, the multilateral architecture. What do you have to say from your perspective? It is becoming unsustainable. It needs to be reformed, and if yes, how? This is the challenge that I would like to ask you, please.
Thank you. First, thank you for inviting me to this important dialogue, especially in this historical period. And I would like to thank you, the Dr. Ettore Greco. Would like to thank you also, Michelle, for the keynote, which was quite inspirational as usual, by the way. So yes, in terms of the WHO, as you know, is not our is not our spring, I should say. It's a kind of dark period. And as a technical officer, and I'm working in the One Health domain, which is something quite it's something quite not really very new, but which is posing a lot of challenges. But at the same time, I think it's a very interesting platform in this moment to rethink about the architectures of health, and maybe I will elaborate more later. And as a WHO regional office, because I will follow this dialogue by looking at what is happening from my window, which is the window of the WHO European region. Where we have 53 countries, member states, working that we support or we supposed to support in the region. The challenge is very huge, and what we call it now, and I would like to add to polycrisis and also to poly uncertainty that Michelle was mentioning. We call it the perma crisis. You know why we call it the perma crisis? Because it's a permanent crisis. So basically, we as a professional, officer working in the global health context, we are working in situations of ongoing, overlapping global crises, regional crises, national crises. And for instance, in this moment, we have to deal with Ukraine, which is part of our region, but at the same time in the Middle East, and there are also some countries in our region that are start to close the borders. There is several things happening at the same time, and then at the same time you have also to follow the normal routine, or you suppose to work on the normal routine. So our tasks are becoming quite complex. And by the way, what I just would like to say is also that being involved in the global health now need also to change our mindset, because I think that sometimes to be very specific in some specific field of work, especially working at the level of the global health organization, it's something that is not really very work with, because we need to have a kind of multi-sectorial, multidisciplinary, open mind, because things are so interlinked. And thinking about the challenges that we face now, of course, the geopolitical tensions, which, as I said, we have several countries that are quite in a kind of critical situations that we have to deal with. And then we have also to deal with the competing national interest, and especially, in some countries also at the European Union level, because we are also having the 27 European Union countries in our region. And so there is a sort of increasing ownership of the portfolio about health, and health is becoming more and more a matter of health security, which is also a kind of limitation, is a very strong limitations. And that's the reason why I was saying that we have really to keep our mindset open and to interlink all the situations that we deal with on the daily basis. And one of the things that we also see in our region, which is becoming an issue and was already an issue during the COVID-19, is the limitations in sharing information in the data access and less coordinations response. This was quite evident, during the COVID-19. And what we try our best, to advocate at country level, but also at the regional, interregional level, that is really very important to collaborate and to get, the access to the information, which is very important. And here there is another topic which I think we don't reflect enough in as a professional, working in the global health, which is the concept of trust. Trust is something extremely important. We have seen it. I think the COVID-19 was a great lesson on this, but unfortunately, we didn't take it properly in our, in our portfolio, in our agenda, because we really, it's a real challenge to work on One Health, where there is a constant lack of trust, among the countries and at the national level, among the ministries. So it's really very something that we have to, and is also the results of unequal distributions of access to health, vaccines, diagnostics, and also financing. And this is what we have seen, unfortunately, during the COVID, especially for what is related to the vaccine access too. And this was creating a mistrust among low and middle income countries. And then, of course, we are facing enormous financial constraint. Last year's 2025, especially the second half of the year, was horrible in our regional office, but not only in our regional office. So I said goodbye to many very high-level professional colleagues because there was a kind of cut, a strong cut that was, a kind of burden. Of course, for countries first, on how we support countries at the national level, but also for the people working in our sector, because now we have limited capacity, and limited capacity means also a limited way to impact, not only at the operational level, but also at the political level, because at the end of the day, global health is a political issue. And as you know quite well, last year, the WHO, there was a reductions for 2026 and 2027 from 5.3 billions to 4 billions, because one of the most important, action was the withdrawal from the US administration. And this has reduced, of course, the workforce and the operational capacity. So it was a very, a quite sort of emergency, in which we live for several months to understand where the organization was going or where it was not going any longer. So it was quite difficult. And one of the other things that I would like to say is also that, and this is also quite evident by working for the WHO, that has a very specific mandate, among the member states, is the fragmentations of the global health architecture. By the way, this is not something new. It's something that is there since many, many years. And but I can see from my point of view, this was increasing. The fragmentations was increasing in the last decades, and this is not really very something positive for the global overall health architecture. Because, but I think that the Susanna Schlein was mentioning, that we really need to look at the mandates, because the fragmented global health architectures the results is overlapping mandates, inefficiency, duplications, and competition for resources, which is also something important to highlight, at least from our point of view. And then also, of course, as I said, there is also a kind of importance of the security issue. So there is a kind of process of framing health more and more as a security issue. And there are a kind of double way to see or to perceive this, because in one way, of course, it can be utilized as a strategy to get more funds, because security is the main content in this, geopolitical situation. So to go to the donors and speak about security, it's something that it can have an audience. But this is going to, in a way, to intervene in the sense of the global health overall. And at the same time, I think that we cannot work always in terms of emergency as a professional, as a professional officer, and sometimes even the donors, they don't understand, that we can't work on basis on the emergency, because we have to think in a long term, context. But working in a long-term strategies is it's becoming quite complex. And of course, it depends then of the topics. So, but this I think is something that we have to, to think about it. And in terms of the WHO Europe, what we did last years in the middle of the financial crisis, was to redefine the regional strategy, the so-called APW2, and this was based, and I think it was a very good exercise, was based on a solid consultations process with the member states. This consultations process took a while, I should say, several months, but it was very, very useful. And even for us working in the global health sector was quite useful to listen the needs and the priority of countries, of the member states, all member states, from the European Union level, Central Asia, and those more in a critical situation like Ukraine. And we have tried to identify which were the needs and the priorities for the next 5 years. And the next 5 years, we will be focused on maximizing their security, because, as I said, it's one of the main, topic in terms of preparedness, detections, and rapid response. And by the way, we also. This was also reflected in our organigram, because even the organigram or the organization was completely revised. And by the way, even tuberculosis now is under the health security division, while before was under another division. And then the focus will be also on the non-communicable diseases and shaping the health drivers. So the cross-sectoral action on social, economic, and environmental determinants. This is a kind of quite important narrative in all the things that we do in the global health agenda. The promoting healthy aging and well-being, because this is something also very important in our region, but not only in our region. And by the way, Italy is quite is having a leading role and is giving a lot of importance of the healthy aging. We have a dedicated office in Venice, driving climate health action by protecting populations and greening the health systems. Climate change, it's becoming a sort of important topic more and more. And then when I say climate change, of course, it's very generic, because climate change is linked to so many things, and is also quite difficult sometimes from the global health perspective to define which are the main actions and priorities and needs when we talk about climate change. And because even in this case, everything is linked, so it's really very important. And even in the case, for instance, of tuberculosis that we are celebrating today, the Global Tuberculosis Day. And then we have also identified in our region the importance to shaping the future health systems, so innovations, technology, and resilient care. And then what I would like to say as a last point is that there is a current discussions at the level of the UN to reform the UN system, and it's called the UN 80 initiative that was presented in March 2025, which is a system-wide reform effort to make the United Nations more agile, integrated, and resilient, for better serving people, accountable to taxpayers, and supportive also of staff. And this initiative is going on. And in our regional office, there is an interest. There is also a reflections going on. And for instance, recently we have discussed about one of the example of to enrich the dialogue, the current dialogue on this initiative. And a good example is the One Health platform, where we have a quadripartite system mechanism, which is composed by 4 organizations working together: the WHO, FAO, VOHA, who is the organizations working on the health of animals. It's not a UN agency, but it's an international organization, and UNEP. And so we are actually working on this as an example to provide for this reform. And but of course there is it's quite complex to rethink the global health architecture, and I think that in any case it's really very, I mean, it's really very important. I don't think there is enough space to think about it, especially if I mean, I'm talking about the WHO, because we are really in a kind of situation in which we have to perform. We have to support our member states because we have also, demands from the member states. But at the same time, we don't have also the time to rethink, especially, I mean, at the technical level, like my level, there is not always or not enough, but it will be very interesting to have more time. And I think the consultation process that we did with the member state was quite a very important exercise. So I will stop here, and if there is any questions, maybe later. Thank you for your attention.
Thank you, Dr. Seravesi. You made us think a lot about the difficulties from your perspective to reframe, to promote, to keep promoting and supporting the global health architecture, to understand what are the needs, and also to see how to still coordinate with the task and goals of member states. But you also mentioned a lot the issue of security, and in this sense, I would like to understand the perspective of the next speaker, because I'm talking about Filippo Molinari, who works for the Defense Institute for Biomedical Science at the Italian Ministry of Defense. Please, Dr. Molinari, can you tell us more about this link between global health and security? And do you think, if I may ask, do you think it's a way to have one perspective of global health, or do you think so it is a little bit of a limitation in the understanding of global health, or do you think it's something that we need to understand as a long-term way of cooperating in the dimension of global health? Please, Dr. Molinari.
Thank you for this opportunity, and I would like to underline that many of the panelists, if not all, are talking about the necessity to find a new strategy to address healthcare and health security in this time of polycrisis and permanent crisis. So as a part of institutions, I think that what we should try to do is to find a comprehensive strategy to have together institutional levels, international organizations, private sectors, and all the stakeholders in the area to address the system, because anyway, the resources are not increasing, and the world is becoming more and more complex and unstable. So I think that we need on two layers a comprehensive strategy that forces us to work all together, and this strategy must be simple, because as said, all the countries will try to use their own specificity of all the institutions. So the more simple it is, the better it is.
Thank you very much, Dr. Molinari. Indeed, very clear. We might have later time to ask for a second round to understand more your perspective. But let me ask to our last speaker. Let's think about more on the side of tuberculosis. Dr. Schlein before was mentioning that the disease is really has a really precise location, in the sense that unfortunately the majority of the diseases are located in Asia and sub-Saharan Africa. But then Dr. Seravesi also gave us the understanding of the European dimension, and also how the geopolitical situation is having an impact on global health. Dr. Anna Scardini, please tell us more about the tuberculosis and the challenges related to one of the deadliest disease in the world right now, please.
So thank you very much for this opportunity. And as you know, I'm working at the Global Fund and specifically on TB, and I've been working on TB all my life. So I wished actually to take it from a bit farther, but I know that time doesn't allow to go too much farther. But I wanted to just remind, because I think everyone knows that TB is an old disease, but no one knows probably, or few knows how old this disease is, you know? And so I want just to spend 1 minute to highlight that TB is really a plague that has been with the humans for thousands of years. Even much before that Robert Koch discovered the bacterium, the causative bacterium of TB in the late 19th, tuberculosis was already there. And it's been found, traces have been found even in mummies, in Egyptian mummies, dated 1,000 years before Christ. Also Hippocrates, the father of medicine, knew very well TB 400 years before Christ, and he called it like disease, meaning consumption. And he stated that TB was the most widespread and fatal disease at that time. So TB really has been there across the centuries, and has also inspired writers and poets. I think everyone knows the Magic Mountain of Thomas Mann, the White Plague, TB, Men in Society of Dubois, who interestingly explored the social and economic factor driving TB, and the very recent Everything is Tuberculosis of John Green. So even in paintings, our Botticelli, Italian Botticelli, represented the pale face of Simonetta Vespucci, who likely died of TB in the 15th centuries. So all this just to say that during all this time, TB has been with us, but there was no cure for TB. There were several empirical approaches, sometimes also very weird, very invasive. Then patients were isolated in the sanatoria. And the only sort of treatment was really the exposure to the sun, to better weather and reinforced diet. And this only 80 years ago, in the 1943, that the first drug, streptomycin, was developed and discovered by the Nobel Prize Waxman. And then in like 20 years, all the drugs were identified, developed to create a treatment for susceptible TB, which is still today the treatment we are using to treat in TB. And then it took several other years, too many years, to have other new drugs to be developed and to become available. And it has been actually only in the last decade that the arsenal, we can call it arsenal of drugs to fight TB, has really been increased and improved, allowing new and better regimens that have been mentioned also before to treat the TB, especially, or including and especially the forms that are more complicated, like those that develop resistance to the drugs. So this is for me just to remind that the progresses in understanding and addressing TB have been always extremely slow. And this is a big challenge, for me the first challenge. Then it became the HIV epidemic in the second part of last century, and still is there. And this HIV epidemic pushed the TB extremely because HIV is the strongest and most powerful risk factor for active TB. And fortunately, TB HIV intervention to address TB HIV have progressed quite well where there is more HIV and TB. But then there has been also the growing drug-resistant TB, adding a new threat. So a lot of challenges already with this slow progress, HIV epidemic and drug-resistant TB. But some progress has been done. I understand the bit negative feeling that we have when we see these progresses because they've been slow and much less than what were the wishes and the targets. But we have been progressing in treatment coverage, in treatment success rate, in the reduction of deaths, even in much lower than the targets, even in the incidence rate, even if really much slower than what we wished and much lower than the global target. And indeed, it has been said that TB remains the most deadly infectious disease, and also that drug-resistant TB remains a dangerous risk for the global health security, with a lot of cases still estimated, and only half of them, or even less than half of them, currently diagnosed and treated. So TB remains today persistent, but also evolving threat that demands, in my opinion, urgency. So no more that slow progress, collaboration, innovation, and smart investment to save what we've been able to gain so hardly and to protect the future generations, including in terms of global health security. Has been said already that TB affects mostly the low-income countries, low-medium-income countries. Actually, 80% of the global TB cases and deaths are in these countries. Personally, I work mostly with African countries, and this region, I think, contributes to a quarter of the global cases. And I see that these countries, the countries most affected by TB, are also those with the weakest already and strained health systems, which also affect the capacity to fight TB. So TB is really a disease of poverty that is highly influenced by various social determinants and which increases poverty in a sort of a vicious cycle if not addressed. We know very well that crowded, poorly ventilated housing, workplace, congregate settings, undernutrition can increase the risk. But maybe a challenge that has not been mentioned yet, well, the under-resourcing has been mentioned, I think, already. It's not the last, it's not probably the first, but I don't repeat. Unfortunately, it's true. We know that the global spending on TB diagnostic, treatment, and prevention has been, I think, less than half of what was the annual target in 2023, including the funding for TB research was half of the target. And that all this reduction in international funding and financial pressures in countries can really have a very negative impact on the global TB response. With more missing cases, with the interruptions of treatment, so the risk of developing more drug-resistant TB, dying of TB, transmitting TB. But I think that a challenge that we need to remind and that we can address together is also the fact that we still struggle to find people with TB. As been mentioned before, that there are like 10.7 million people estimated with TB in the last global TB report, so in 2024, and about 8.3 million have been found, meaning that 2.4 remain missing, not reached by TB services. And this mostly in the 30 high-burden countries across Asia and Africa. And I think that these highlight enormously the need to increase access to TB diagnostic services, because we first need to identify patients to treat them. Now we have better regimens, much better regimens, especially for drug-resistant TB, and also for TB prevention, shorter and better, so more effective and efficient treatments, but we need to find people to be treated. So we need also to address those barriers that can limit the access. Maybe if I may give a couple of examples, because I think that example from the countries we do work with, we support and work together could be really useful. Also because I think it's extremely important to learn from evidence, to generate evidence, and to learn from what works, to try to repeat, adapting to different contexts, and also to avoid what is not working, mistakes, some approaches that maybe are not really impactful, should probably be abandoned. No, I heard before the idea to have a real strategy. Probably each country needs to find its own, but there are some examples that can really apply to various other. So for instance, I mentioned the treatment and have been mentioned shorter and better treatment for drug-resistant TB. Only in the last decade, we have these new drugs, and in the last few years, WHO has been recommending shorter, like 6 months, full oral regimens without injection for treating drug-resistant TB. But it has been taking a time for countries to adopt it. So we've seen when we come with really a strong engagement of the country leadership and the collaboration with partners and with the communities and in country leadership, we can move faster. So for instance, Indonesia, that is the second highest TB country in the world, with 1 million people with the TB every year, and drug resistance as a major threat in the country. With increasing domestic resources and the support of the Global Fund, the country was able to really implement a full program to address drug-resistant TB with a large number of new sites, 460, and with a transition into this shorter, better regimen, which is short and also cheaper than the longer, quite fast, because between 24 and 25, they could move from 17 to 80% of patients with drug-resistant TB receiving these better regimens. I think it's extremely important to see what works. And then I was mentioning before the need to access, because we miss many people with TB, and so we need to allow these people to access diagnostic services and also to access any innovation we may have. And I think I've been mentioning already some before, that fortunately now we have much more innovation on TB than previously, on treatment, but also on diagnosis, on TB screening, like the artificial intelligence that has been really revolutionizing the TB screening by rapidly analyzing in few seconds digital X-rays, chest X-rays, and identifying people with presumptive TB, even in settings without training the radiologist. And this, of course, improves the early detection, reduces the missed cases, and increases the efficiency. And we have a good example in Mali, in Chad, in countries where there are refugees camps, but also to do active case finding campaigns, TB screening campaigns in minors, nomads, and people living in underserved villages. Really reach them with good technology and to ensure a diagnostic. Europe was mentioned also, and I think, for instance, an example coming from Europe is an example from Ukraine, because mobile diagnostic unit can include not only X-ray, but it can include also a platform of molecular testing like GeneXpert. And this mobile unit provides this way TB diagnosis on wheels, reducing geographic barriers and expanding access. So, for instance, Ukraine, where the war has damaged thousands of health facilities, disrupted the supply chain, a global fund has supported the mobile health units to reach communities on the front line of the war. And these were equipped to really provide on-the-spot TB screening, diagnosis, and treatment alongside the HIV primary care. And between 22 and 25, it was possible to really reach about 30,000 people in 450 communities. So even in the middle of active conflict, there are solutions, there are possibilities. And these mobile units often are the only access to care. And this protects the continuity of the TB treatment and prevent the transmission and the spread of the disease in a country where additionally there is quite a lot of drug-resistant TB. So I think that, challenges are multiples, and that have been highlighted also by the colleagues, but also solutions are there. And so what really we need, I think, is to find a smarter way. Sometimes it's integration, sometimes it's the take of the innovation, is the optimization, optimal utilization of what exists already. Sometimes it's really targeted, focused intervention where they are more needed. But I think we should be also optimistic, because today, compared to all the previous years, we have a lot of tools to fight TB. So for me, it really is a matter of use these tools and make them available where they are needed and faster than in the past. Thank you.
Thank you, Anna. Indeed, I like the final positive approach you mentioned, and it also couples well with the springs coming in Europe. So I like to see it in an optimistic way. But you mentioned a lot of important challenges. You also mentioned one dimension that maybe was not recalled enough, that TB thrives in fragile context, also conflict zones too, very often. And you mentioned the Ukraine case. For the next question, I have really, I'm asking you just a 2-minute response, and I would like maybe to start with Sima Seravesi, who unfortunately has to leave for another meeting. And I would like to ask, we have talked about the challenges, but let's see in this sense, we know now that TB and a lot of communicable diseases are often coming from a mix of social, political, and economic factors. In this sense, what could be the role of international organizations and what should be the priorities. You mentioned that your organization has recently developed a work to understand the perspective in Europe. And can you please tell us in 2 minutes what are the outcome of this work and what should be the priorities in the long term, in the medium and long term?
Thank you, Marianna. It was just published a WHO ECDC report on the tuberculosis. And so I'm not going into the details of the landscape of tuberculosis in our region because I think it was there is no time. But in terms of potential solutions, what we say and what we advocate for, it's about political and governance measures. So we encourage the countries to prioritize TB as a national and regional health security issue. And then, of course, we advocate with country to ensure a sustained financing and integrations of the tuberculosis programs into broader health and social policies. And by the way, this is something that is also for other programs, not just for TB, and strengthening collaborations across the sectors. This is something that I emphasized before. So we really have to start working together, and joint collaboration is a key. And but not only across sectors. In the case of the tuberculosis, especially if I'm thinking about our region, it's also important to work across the region because it's also a matter of border. So it's something that is going beyond the border. So we have to tackle also the migrations and movements of people. And so across sector is not enough, but it's something that we have. I mean, we have also to consider the geographical situations, particularly in conflict-affected or fragile context. In terms of medical interventions, what the WHO Europe is recommending is to expand early detection and provide a shortened and oral treatment regime for drug-resistant TB. I'm going very fast to improve the TB and HIV services, to ensure the comprehensive care, maintain vaccinations programs. I think that my colleagues from Global Fund was already, in any case, mentioning these things. And then another important action is to be focused also on community actions and to focus on high-risk and marginalized population. And promote the health literacy and community engagement to reduce the stigma, address social determinants of health. And in terms of international cooperations, the potential role of international cooperations, we think that it's very important that there is a cross-border coordinations from different organizations, like in our case, WHO and ECDC. And but also we need support, from the international cooperations to perform, and also, I mean, this support is for helping and supporting especially the low-income countries to maintain the TB programs, even in case of conflict or economic challenges, as we can see in our region. And another thing that we have to improve is also the innovative tools that were already mentioned, and also sharing the best practices. And in any case, what I would like to say, there is a call to action that was that the WHO and ECDC are calling on member states and the European institutions to urgently intensify the TB preventions and early case detection, and scale up access to WHO recommended rapid diagnostic and drug susceptibility testing, particularly in high burden settings, expand shorter all oral treatment regimen for the drug resistance TB, and strengthen integrations of TB and HIV services, as I have already mentioned, improve surveillance reporting on HIV co-infections, TB in prisons, and treatment outcomes to support evidence-based policymaking. Of course, this call to action is based on the results of this report that was just published, that I don't have the time to give you more detail, but it's published, so you can find it on our website, on the ECDC website. So thank you for your attention.
Thank you, Simona. Of course, we will see the report, and thank you very much for detailing the outcome. Let me ask to Dr. Schlein, in a way, prevention was really highlighted by Dr. Scandilli, Dr. Seravesi before, and also understanding maybe the community perspective to prevent the stigma, to prevent vulnerabilities, and to prevent the spread of the disease. I'm also thinking back to what Dr. Kazaskin said about the role of donors. He explicitly said that ODA will not be dominant anymore, but should be a complement to other type of actions and other type of partnership or cooperation. In this sense, I would like to have your point of view. I know it's just 2 minutes, but your point of view on how ODA, so how donors can complement this type of cooperation for health issues and health cooperation. Thank you.
It's a very important and interesting point, I think, because we are a bit used after decades to think that, for example, we need a co-financing from recipient states to our policies, but it should be the other way around. So it should be, I don't know, the Global Fund, for example, co-financing the domestic health policies. And that's a pathway. I mean, that's what always Peter Sands, also the CEO of Global Fund, is always saying. We cannot imagine it as a sudden switch. We cannot imagine that out of nothing suddenly we are in a completely different situation. But it's a pathway, and I think, I mean, recipients country, first of all, and also the community of donors are understanding that that must be the direction in which we shall move. So really helping countries to take in their hands the management of their health sector, and not only, and help them prioritize, because it's naturally not easy, integrating what we built up in the last decades in their national systems, which seems to be something obvious. It is not, and it's not always easy to do it, because you know, in any country, in the course of time, I mean, different approaches were born, institutions dealing with HIV, one for HIV, one for malaria, one for tuberculosis, and the national systems separated, and integrating everything would mean that some of those systems would cease to exist. So it's a challenge for sure, but it's I mean, in this situation, it's the only way we can go, and so it's quite our I would say our most important priority to go in that direction.
Thank you, Dr. Schlein. It is very clear, and please, I would like to ask the perspective of Filippo Molinari in this sense. Should the perspective of security, would you please give us your thoughts on how international cooperation should delve more with the link between security and global health?
So, I think we need to work on 2 layers. I will be quick, but one is on security, because every crisis in the world is even a crisis in healthcare, even if it's a social crisis or an economical crisis, because we see, especially TB, it's really linked with social issues and certain class of people that maybe have difficulty in accessing resources. So we have to put together healthcare and social security at that level. And the second layer, so different health organizations now are boiling, as we heard, because of withdrawing of funds. But I think we still can work together, having simple and clear targets. Maybe not as big as before, but if we have a precise target and concrete, we can address it all the parts together. So from public institutions to international organizations, NGOs, private sectors, whatever, if we have a clear path, even if it's a small target but robust, we can after each target address it and have some results, real results on concrete, because at the end, when you are on the field, you need drugs that works on TB, you need diagnostics, you have patients asking for help, and we need to have from political guidelines to practical guidelines and tools to people on the ground.
Thank you very much, Dr. Molinari. I'm thinking that you mentioned very clearly, as also Dr. Schlein mentioned, that there is a need maybe in this international scenario we are currently experiencing, there is a need to help countries to prioritize and to help countries to build a stronger national system, even in the global health, in order to keep cooperating and enhance international cooperation. And of course, the Global Fund is one of the most important actors in the multilateral system regarding global health. I would like to ask Anna Scardigli, what are the objectives in the long term of the Global Fund regarding the international cooperation to fight tuberculosis? And if you can please give us your point of view on the current goals of the Global Fund in this sense.
Thank you. I think we are a bit with a short time, so I try to be very quick. I think that our goals and objectives remain the same. Those that are in our strategy that is still there till 2028. And our goal is really to support countries in fighting the 3 diseases while strengthening the health system that has been mentioned to be key, essential to support the disease-specific programs, and while supporting countries for a sustainable transition, because as has been mentioned, funds are always less, and domestic funding become, in this sense, still more critical, essential, no? But also, I think thinking to now what is our not focus, but an area in which we think we should invest very much. Speaking about TB, of course, is something that has been mentioned before, no? The innovation. Because as I said, we moved very slowly, but now we have a lot of innovation that have been mentioned. And I think that investing in TB innovation can really bring us closer to ending TB, at least as a public health threat. But it's not enough innovation. We need to allow and to push the access to innovations. And so these new tools can only change the outcomes if they are really deployed rapidly, at scale, and reach the people who need them most. So if I can quickly give an example again, because it's something that probably has not been mentioned before, or maybe yet, among the various innovation and the various new tools we have to tackle TB, is, for instance, the near point of care test, something that has been very recently approved and recommended by the WHO 1 month ago, or some weeks ago, I think. These are near point of care tests, as the word say, as the name say, molecular tests that can be utilized to diagnose TB very close to the patient, near the point of care. And so they have the enormous benefit of really increasing access, being so close to the patients, even at primary health level of care or community level. So decrease those barriers that make it difficult for still many patients to reach laboratories. Even rapid molecular diagnostics such as GeneXpert and TrueNat that have already transformed the TB detection compared to the old microscopy are not accessible so much, while these tests can be much more accessible. Also is much better compared to the microscopy, that is the most decentralized tool we still have, because improve the quality of the diagnosis with a much more sensitive diagnosis. And also is cost effective because compared to other rapid molecular tests, these near point of care are much more cheaper. And so I want to say that actually the Global Fund is supporting already this year in 2026, 13 countries that are called early implementers to implement already this year this new tool to diagnose TB in a very decentralized way. And this will generate lessons learned and operational evidence that can help other countries to move faster with the introduction of these tools. So again, it is a support to generate evidence, but to make it faster the uptake and to increase the access to the tool and the access to the countries and then to the population that need. And to finish also, I think it's important to remind that the Global Fund partnership really is trying to help equal and timely access to these innovations and other in various ways, trying to reduce the price to make these tools affordable, more affordable, especially in this constrained funding environment is extremely important. So through the market shaping, the partnering with private sector, there are efforts to bring down prices. Also through the pooled procurement and market shaping, it's been possible to expand, to broaden the range of tools available for procurement. So also for the TB imaging technologies, we go from the mobile and portable, stationary, and different software for artificial intelligence become available to countries. And then we work to increase the access, also working with the governments and the communities to really try to design and deliver programs that take in consideration stigma, discrimination, geographic isolation, so to really maximize access and uptake also to those populations that are most in need and less assessed, to ensure that these tools can really translate into real world impact. And finally, as I said before, the sustainable transition. So really, as external resources decline, domestic investment becomes increasingly important, and we promote co-financing requirements, sustainable planning, to really make sure that the resources are still there to allow all these innovation to be utilized effectively also on the long term. So I think that in this short time is what I can say. Thank you.
I think it was perfect, Anna, and I thank you very much for the clarity that you all had to express all these points, important points, and all these goals for the Global Fund, but also for all the international partners working on global health and tuberculosis, to fight tuberculosis. And I would like to give the floor directly to Stefano Vella, Vice President of the Friends of the Global Fund, to give us the conclusion of this interesting and important panel that we had today to discuss global health and tuberculosis. Thank you, Stefano.
Yes. First of all, let me say that it's very difficult to summarize an enormous amount of suggestions and information. But first of all, let me say that as friends of the Global Fund, we are very proud to be here with the Institute for International Affairs. We work with them very closely, and it's an honor indeed. I took a few notes that I, again, not in order. First of all, let me say that I'm a little, I understand what Michelle was saying about the pandemic treaty difficulties, and this is again what I would say. This is maybe caused by the sovereignism, which is saying, no, I know how to do. I don't need someone tell me things. But it's also the proof that
COVID lessons have not been taken. Anyway, from Michel, that we first of all, we share the same despair for the global health response, which is definitely off track. And indeed, we have this decrease in US funding, but not only, unfortunately, because this ODA decrease is common also to other Western countries. It's an unfortunate direction. And so let me say that I would like to touch what Susanne Schlein said, that it will be difficult to mobilize more resources. So we may need to use what we have more effectively, cancel fragmentation and duplication, and have a kind of synergy between programs. Someone has touched the tentative of Gavi and Global Fund to work together. Now let's see where they will go. But two things very important, as Susanne Schlein said, is we need to increase the role of civil society. Particularly, I think from the Italian side, we have a very, very strong civil society that works in Africa since years. Italy is known in how we bring health. And so civil society, the private sector, we touched it in the last meeting. And then, of course, the issue of innovation that was touched by Anna. Of course, we have now innovation, both point of care diagnostics, new drugs, maybe a good vaccine, maybe. But the issue is access to these tools, new tools that we have. And Simona added something important, which is the wider view of touching non-communicable diseases. So, and try not to work on silence as we were accused to do. Let's put together area, but also other. Finally, I would like to say that with Michel and Martin McKee, we try to write something regarding the value of health. We need countries to understand, but and only the countries and the rich countries, but the low-income countries, the value of health is a tool for development. Health is development, also security. But we are scared that not all the low middle income countries, let's say, have put on the health of their citizens. Is not their only priority. It should be. And of course, the issue of co-financing and with ODA is there. And lastly, I think coming back to security, one important touch is wars and conflict and fragile context, because we know that health impacted by wars for a long time after the war, beyond the deaths of the war itself, because of the kids not vaccinated, because of the the health systems destroyed. So unfortunately, the consequences of conflicts that I would like to remember, we are talking now about 3 main, but we have more than 20 conflicts around the world with displaced populations and very, very difficult situations. So let me say that the only issue that I see, which is real as very unfortunate, because I worked for many years and I'm a friend of the Global Fund, is the issue of going that all countries prefer to go bilateral and not multilateral. And this is a trend that unfortunately will stay. So sorry, it was difficult to take everything. It was everything very, very important. And I know that Mariana will produce something beautiful as usual. Thank you.
Thank you very much. Thank you very much, Stefano. And thank you very much also for the conclusions. And indeed, it was a very complex topic to discuss today. But I thank all the panelists and Dr. Kazaskin and also Dr. Vella for the conclusions, for the capacity to dialogue, to debate on this important and crucial issue that we have. And I always agree with Dr. Vella when he says, not only when he says that health is about development. And I think it is indeed something that we have to keep in mind in the future. So thanks to all the panelists and to all the participants. And I also would like to specify that that this webinar will be available on the website of IAI. So thank you very much and see you next time.